Take a breath in and all the way out. All the way out. Hold this. Hold right there. Pull this up. Bottom leg straight. Right where it needs to be, essentially. What do you feel? What do you feel?
I felt a little crack there.
Already, yeah. And in. All the way out. Good, good, good. That was an interesting sound.
Yeah. Sorry.
You have nothing to be sorry for. Hi, Amir. Thanks for coming in today. Good to see you again. Why don't you go ahead and share what's going on?
So I came in because I felt like I had a little bit of issue with my spine. I felt like a little bit more compressed than usual. I like to lift a lot, and I also play a lot of sports. And I feel like I just I do a lot of stretching. I do a lot of foam rolling and everything like that. Things just to make my body feel good afterwards. But it feels like just everything feels a little bit tight. Okay. Mostly what my biggest dealing issue with right now is around my hip area. I have this like little bit of sciatica pain that shoots up from my glute all the way down to like a little bit my hamstring sometimes, but I feel it mostly in the glute. Okay. And what I've been told before is that there is a little bit of an imbalance in my hips. Okay. Like one side of my hip is more anteriorly tilted compared to the other one, and what is causing like a little bit what they call like short leg, long leg kind of thing. Okay. So I tried to do a couple of like corrective exercises for it. I didn't feel like it was fully working. I felt like some benefits like after a little bit, but after a while it's like every time I still try to lift heavy, that sciatica still pops up.
Still
like,
there. Right?
It just feels like a glute punch every single time. Like just the glute's either not following, and I'm sure it does because I have seen a chiropractor before.
I can tell with the language you're using with the leg lengths and the pelvic tilt. It sounds like the more traditional approach to chiro.
Yeah. Okay. So I've talked to chiros, I've talked to other PTs, and the thing they told me the most is like usually it's around the hip imbalance, and they do like I remember they were doing one test where they were trying to test my abductor strength, a lot weaker on my right side as compared to my left. I do feel more stable on my left than I do my right, and it's just I don't like there are obviously like what I did was I just took a step back from the heavy training and just kind of reintroduce it, and that tends to be okay. But usually when I get back to that like 3 plate mark, it just comes right back every single time. And I don't know if it's a product of trying to get there too fast or I just don't know.
How long has this issue been going on for, and how long have you been building up back to that 3 plates?
So I've been dealing with this issue for like a long time. I want to say like 7 years now.
So long. Long time.
But there was like the year of 2021. It was like pretty good. Like it was just more manageable, and I managed to get up to like 3 plates for like 6-7 reps.
Good. All right.
But then I tore my back, so that was a result of overtraining.
Now, just to clarify, you say you tore your back. Yeah. Did you get an actual diagnosis?
So they put me under an MRI. They told me I may have partially torn. It was like a partial tear in my lat and in my glute mins.
Holy crap! Okay, yeah. So that's a legitimate tear then. Okay.
Yeah, like more or less.
And this was 2021.
The end of 2021. Yes.
Okay, so since then, have you had what's your recovery process been like? What have you done? Is that fully healed? Are you still feeling the repercussions?
My back feels fine for the most part. Like usually, maybe there's more of a psychological effect where I'm like, oh, if I go too heavy.
Definitely.
But but I hit 3 plates again like 4 months afterwards. But
wasted no time.
Yeah, I wasted no time, and I managed to get it up for 3 reps, but. I don't know. It just feels, as of recently, it feels like everything's degressing a lot faster. Again, I don't know if I equate it to more like my back not being right, because it feels like it's been taking a beating, more wear and tear, and it feels like I'm doing a lot less and feeling it a lot more now. Okay. Yeah, and I don't know why. So.
All right. How old are you, Amir?
27.
You're 27. Okay. Amir's past that magical age of 25 where our bodies start to feel a little bit more worn down. So I can intimately relate to him with this complaint here. I used to squat a lot heavier, can't do that anymore. But is that the reason for feeling sciatic or glute pain on your squats? No, it shouldn't be. Okay, it's not like you magically turn that number, suddenly you're getting pain. There's probably some kind of issue. Well, not probably. There's definitely some kind of issue here that needs to be properly addressed and has either been missed or there wasn't a high enough caliber of treatment delivered to it. For whatever reason it was. We're going to hopefully figure that out during the exam. Anything else to report? Is your main concern really that kind of the lower and upper back and the glute pain in there? What about the neck? I know you said you felt compressed, but is there anything in the neck, or is it really just upper and lower?
My neck feels... I used to crack my neck a lot, a lot. But then I kind of stopped doing it because, again, I don't know. It's like, oh, cracking your neck's bad. I don't know.
Yeah.
I just stopped doing it altogether.
Fair enough.
But something I do notice is like a little bit of my shoulder as well. It's like I feel like there's a lot of tension in my upper trap, and that kind of messes around with... I think it has a lot to do with my benching technique, because I do switch up the grip once in a while, but there tends to be a little bit of a flare up more in my right trap more than usual, and that's kind of new. It didn't really. I've had a previous injury on my right AC joint, but over time I just kept strengthening it and it got better. But I tweaked it in November of last year or December of last year.
Okay.
And it just hasn't felt fully the same since.
All right. What have you done? Sorry, I just got something in my eye there. Yeah, what have you done to manage it since, if anything?
Just strengthen it. Just do a little bit more shoulder workouts. Like I work around the shoulder. Like because obviously the shoulder is such a complicated mechanism of.
That it is.
Yeah, like
you would know actually being a personal trainer, right?
Yeah. So I did. So the pain localizes at the trap.
Okay.
But I used to feel a lot in my front delt, not as much anymore, but now I feel it more in my rear delt. Okay. And then sometimes in my front delt. All right. It's usually in an upper back.
So we'll screen the right shoulder as well as the upper back, the lower back. Anytime you do have a shoulder issue, it's still good form to at least screen the neck because the three of them are very intimately connected biomechanically. When you get an issue with one, you will develop issues with the other two as well, given enough time. All right. So I think that pretty much covers the history, unless there's anything else that you want to mention. He's deep in thought.
Yeah. No, it's because because this is basically what I would do. Like it's like anything else, just one more.
Yeah, like to one of your clients.
Yeah,
right?
yeah. So because and I trust you, and I want to give you everything that I got. There's one thing that I do equate more right side issues than left side. Okay. I would call it maybe a sports thing. Like I was a D lineman, so I've been a very stretched out position on the right side, and I played right hand down a lot most of the time. Okay. So maybe that's something to consider, but I don't know.
How many years ago was that?
I played for 6 years, and the last time I played was 5 years ago.
It's possible. It's more than likely that you're just dealing with stresses that you're dealing with nowadays, right? Because 5 years is a pretty long time, especially we reverse back to under that age of 25, that you would have just recovered from whatever kind of, not trauma, but stresses you're putting your body under there. At least that's my own clinical opinion with that. Okay. Is that good for this? Okay, good. Then what we'll do now is we'll get into the physical exam, we'll do the full screening, and then we'll figure out what we're going to do treatment-wise. Okay. Let's do a brief neck range of motion exam. We can get you to bring your chin down to your chest for me. Good. Any discomfort in which shoulder was it? That was by your right one?
It's the right one.
Yeah. Any discomfort in the right side of the neck, shoulder, or left, or anything in the upper back? No? What if I go ahead and push down further? Still okay?
Yeah.
Good. Okay, come back up, look towards the ceiling. Anything now? No? Okay. Still okay?
Yeah.
Good. Rotate as far as you can to the left, please. We can get to about 60 degrees on this side, and now rotate as far as you can to the right. We can get to, actually further on this side, we can get to about 70, so that's good. Forward, tilt right ear to right shoulder.
As far as I can.
Right, that's okay.
Yeah, I feel a little stretch.
A little stretch on the left side, okay, that's normal. Left to left. Little stretch on this side.
Yeah.
Okay. His neck seems pretty clear with the full range of motion, so I don't think there's no need for treatment up here, but let's take a look at the shoulder. I'm going to get you to give me a thumbs up, arm straight, keep it there, don't let me lower it, okay? Any discomfort in the shoulder with that?
No.
No? Okay, rotate downward, give me a thumbs down.
Ooh.
Felt a little click there.
Yeah,
Can I push down? Is that painful, or is that the same?
It's like a 2.
It's a little bit more uncomfortable, eh? Okay, so we're going to relax now. Bring the arm back here, keep it here, all right? Don't let me move it. I'm going to push it, you don't let me move it.
Okay.
Any discomfort with that?
No.
No? All right, now we're going to come back the other way.
Oh, this is going to hurt.
That's uncomfortable, eh?
Actually, no.
No, it's not. All right, so we were apprehensive about it. All right. Why don't you put your hand behind your back for me? Ooh, a little clack there, but you can get it up high, eh?
Yeah.
Okay, so what we just did there was we just screened all of the rotator cuff muscles, okay? And it's the only one, you're good, you can relax there, that actually was at all aggravating was when you did the thumbs down.
Yeah.
Yes? So, for you on the channel, if you haven't seen this one yet, that's actually going to be his supraspinatus impingement, or supraspinatus, bit of an issue there. It's the most common rotator cuff muscle to develop some kind of issue, all right? So that's a basic rehab plan that we should be able to work to strengthen and better. I'm not sure what have you done to rehab this at all since?
So, supraspinatus, nothing. I don't really, like rotator cuff work, I usually just focus on my favorite exercise for that kind of stuff.
That?
XY raises. So,
Okay.
front, and then the Y raise. So
Okay.
I just superset that. And then just we'll focus on like a little bit more just overhead pressing, and that's pretty much all I do. And
Sounds like you're already doing a really good job of it, if that's the case. And if anything, that's probably why the shoulder is doing as well as it is because you have knowledge of your body and you've kind of been able to reason it out yourself. So even with that, that's actually a full rehab plan, basically. If he's already able to achieve that range of motion with the resistance. So good job. Give yourself credit where credit's due.
Thanks.
All right, so then next up, we're going to be looking at the low back. I'm actually going to get you to just stand up for me right where you are.
Yeah, sure.
And I want you to bend forward, try to touch your toes for me, okay? Any discomfort in the low back with that?
No.
No? Okay, come back up the other way. And I want you to bend backward, extend now. Any discomfort in the low back? Whoa, this guy can limbo. That's more than I was expecting to see.
No.
Anything in the low back there?
No.
No? All right, so next up, we're going to get you to lay on your back, please. Remember, Amir's primary complaint is that sciatica he's getting in his, right or left? Right hip during loaded squats, all right? So we're talking like 3 plates or more. Is it always on that initial rep, or is it after a few?
Usually after a few.
Okay,
Usually
after a few.
After like the second or third rep.
All right, we're going to bring this leg all the way up. You let me know if we get any recreation of that in the back or the glutes. Anything?
It's just a tight stretch.
Tighten the hamstrings there. Okay, I want you to slowly lower the leg down yourself. Slowly lower it down yourself. That's okay?
Yeah.
All right. Same deal on this side. Lift it all the way up. That's even tighter on this side, eh?
Yeah, it's pretty tight.
And now slowly lower down yourself. That's okay?
Yeah.
All right. So.
I felt that a little bit more on my glute on this side.
So while you were lowering this, you felt that on the glute on the right side.
When it was stretched, yeah.
Oh, when I brought it up, rather.
Yeah,
Okay.
yeah.
We're gonna bend the knee, bend. Good. You got long femurs, guy.
Yeah.
Right. I'm gonna push through. I can't even get over them. Okay, I'm gonna have to do it on that other side. But let's try this leg first then. Relax this one. Good. Holy shit. I hate being short. All right. Is that okay?
Yeah.
All right. That feels good, you said.
Yeah.
Okay. It's literally like as long as my torso. That's okay.
Yep.
Okay. Bring the hip all the way up. Any low back or sciatic with that? No? Okay, and actually let's do internal rotation too. That's okay. And that's okay too. Good. That's all okay. All right. Let's get you face down, okay? So your arm rests in front of you there. Perfect. Okay, right side. So when you do get that discomfort, it's primary in the glutes.
Yeah, right
here?
there.
Okay.
Yeah.
So I'm gonna poke through there for a minute, see if I can bring any of it on. That's okay there?
Yeah.
Okay.
I feel it like right here.
Right on the hamstring
Yeah.
insertion, actually.
Yeah.
Okay. Well, let's still check the piriformis. That's okay.
Yeah.
All right. And then when you do get the pain, does it go? Sorry, remind me. It goes down the leg a bit to like around this region,
No, it just
or it's right there.
it just pinches right here.
Pinch right there.
Yeah.
Okay. So to clarify, that spot.
Yeah.
Okay. Do you know what that is?
Oh, what is that?
Are you aware what the ischial tuberosity is?
No.
It's okay. So the ischial tuberosity is the origination site of our hamstring muscle group. Okay. Also known as our sit bones. Okay. So if you are feeling the pain or the pinch right in that region, then it's possible that this is a posterior chain issue or a little tendonitis of that group there. So how would we treat that? The treatment for that would involve actually some electroacupuncture on the region. Have you ever done that before?
That's what they were doing in physio.
That's what you were in physio. Did you have any kind of positive response to that, or did they do deep in here, or?
So they did acupuncture, and then they added like electromagnetic stimulation to it. By adding clips to it.
Yeah, so that's what I would recommend doing. Did you discontinue that, or?
Yeah, it was feeling pretty good.
Oh, so it did help you, but
I think it was helping. I just kind of stopped.
Fair enough. Okay. In addition to that, I would also still want to work everything around it and make sure that you are moving properly in the pelvis. Your core bracing technique, I'm curious about that too. You probably do it right because you're a personal trainer.
Yeah.
How do you brace your core? Do you draw in or push out?
So deep breath in, the 3 Bs, and then just flex.
Flex, and you're pushing out into fingers or drawing inward?
I more draw inwards.
Okay. All right. Well, let's talk about his treatment plan a little bit first. So first off, we've determined that his discomfort is primarily at the ischial tuberosity. I'll throw a picture of it up there for you guys, which is the origination site for our posterior chain or our hamstrings. All right. Now, the other thing we mentioned was during his core bracing technique, when he's squatting, he's unsure if he is drawing his core in or pushing his core outward. Now, the proper way to brace one's core is to push outward, not inward. Very common misconception. So one thing we are going to do is going forward, he's going to be paying more attention to his core bracing technique to make sure he's pushing outward in order to support everything better. When you can get these little pinching sensations and whatnot, it's not true sciatica in this case. It could be a result of any one structure just being pulled a little bit too far, and we get that kind of mobility or that kind of instability if we're not holding everything tight during our heavy lifts. So that's kind of the recommendation that I've given him, and he's going to report back to me on whether or not this has helped him, whether or not it hasn't helped him, and it's going to help guide what to do going forward. Got all that, Amir? Perfect. All right. Now, I was also just talking to him about what he finds rewarding about his job as a personal trainer. So what is it about that? Because I know that you're quite passionate about fitness. You have been for a long time.
Oh, yeah.
So why don't you go ahead and tell us a little bit more about it?
So the one thing that I love of what I do is that...
All right, 1 sec. Let's get rid of the paper there to not mess up with the microphone.
Yeah.
Go ahead.
The one thing I do love about my job is that fitness, or how I started this job, is that fitness played such a huge role in my life, and how it changed my perspective on everything, and it made me believe like you can accomplish so much once you start focusing on your health, right? So that's where my love for it started, and then it got a lot better when I started seeing that change in other people, like how their lives have completely changed just because they added fitness into their life, right? And seeing people accomplish their goals is also a great thing. So the one thing it's very rewarding to see someone's life change literally right before your eyes,
100%.
which is really, really cool for me, which is why I love personal training. So it's just one of those things. It's like no matter what your goal is or what you're trying to accomplish or like what you're trying to do with them, like I'll give you an example. One of my clients, he was stuck at a 1 rep max
a plate for a while.
For bench?
Yeah, for
Okay.
bench, right?
Mm-hmm.
We did we've been working together for what, 4 months now,
Mm-hmm.
and now he can rep it out for 7.
Nice.
Yeah, and we did that just today.
Mm.
And before it was that was my 1 rep max before. And he used to tell me I never thought I could be athletic, but now that I feel like I am, I've been trying more sports and I feel really, really good.
Good.
So, and yeah, it's little things like that, and or when some of my other clients yeah, my clothes are fitting a little bit better, and just literally seeing results on. Just seeing the results when we do our in-body, it's it brings me such joy. It's so cool to see how they're transforming right before my eyes, and I'm I want them to just keep going and going and going, because that's what fitness is. It's a part of your life. It needs to be a part of your life to make yourself feel better, and obviously you can break it down logically as well into terms of all the health promoting chemicals, everything that muscles provide in order to help you just stay stimulated and not being lazy. But yeah, it's why I love when people stay active and stay chasing goals.
I don't think I could have said that better myself. The benefits and the reward you can get from helping people achieve whatever it was they were struggling with, it's a greatly intrinsically rewarding thing. So thanks for sharing that. Seriously, we can tell that you're obviously passionate about it.
Yeah.
All right, good. Relax as best you can. Take a breath in and all the way out. Good. In. All the way out. So we had some subtle ones there. Not sure if the mic picked them up, but they were there. Now we'll get you on your side facing the wall. All right. Good stuff. I will pull this. Good. And we will hold right there. Good, good. We'll pull this up. Bottom leg straight. That's right where it needs to be, essentially. Good. So in through here. What do you feel? What do you feel?
I felt a little crack.
Already, yeah? I'll get you to actually scoot your hips a little closer to me, please. Bring them closer. Good, good. All right. And in. All the way out. Good, good, good. That was an interesting sound.
Yeah. Sorry.
You have nothing to be sorry for. We'll get you on the other side.
Yeah, one thing I didn't preface is that I'm probably going to make some weird noises.
That's okay, man.
Yeah.
I have quite a few patients like you, actually, that make some of the strangest sounds in the world.
It's felt good.
Scooch the hips towards me, please. Good. Awesome. All right. And I'll kind of move the camera so that my ass isn't in the middle of it. Okay. Sorry, guys. And relax right there. Breath in. All the way out. Good. And in. All the way out. Good. Good. Okay, I think we got them all on the first one, actually. So we were talking about before, Amir primarily feels that pinching deep within the ischial tuberosity. Are you going to point to, am I a little bit off it? Yeah, I'm not quite on it now. I've got to go actually finding it first.
Yeah.
Right in there.
Yeah.
That's right there.
That's,
Okay.
Yeah, there it is.
Bony protuberance there. There are sit bones, okay, guys? So what I'm going to do is I am going to be putting a needle right in that, and then also further down for the semimembranosus and the semitendinosus. It's the two parts of our hamstrings. They're two separate muscles. So let's go ahead and find that once again. Right there. Yep. Oh.
You moved it. You literally, there it is.
There it is.
Yeah.
Okay. Yeah. All right. So needle goes right there. Good stuff. Breathe for me, okay? It should calm down over the course of the next 30 seconds. If it doesn't, you let me know. All right, and that's about 6. Breathe for me. So fun fact for everyone watching. Acupuncture, the placement of the needles, is based off of something called chun, which is a real word, apparently. But the way that works is that each chun about equal to a thumb. So 6 tune, 2, 3, 4, 5, 6. Away for the next hamstring. There we are.
Oh my God.
He was not kidding about the sounds that he was going to make. Can we see those on the camera? Yes, we can see all three. Perfect. All right. So here's what I'm going to do.
What are you doing to me, man?
You okay?
Yeah.
Is it calming down?
A little bit.
A little bit? Okay, well, we're about to electrocute you now. Just because, it's therapeutic. So. All right. Now, it's important that we do pass current up in through the insertion point because that's where we're feeling most of it. As for whether or not we hit semimembranosus or semitendinosus, doesn't really matter. They're both going to hit the area we want to, so we're just going to go in on the medial aspect here. Actually, we're going to insert that one a little bit more. There we go. What is this one? There we go. All right. Okay, and we're going to turn on the current now. And you let me know when you start to feel a little tingling through that area, okay?
Yep, there it is.
You feel it there? Okay, there we go. So now, actually, I think you guys can see that on the camera. Maybe not. But it is a little tricky to see with black pants, but we are getting activation of the hamstring group in through this area all the way up into the insertion. Now, how is that on the tolerance level? That's okay?
It's a little bit high.
A little high? All right, let's turn it down just a bit. I don't want you being uncomfortable. How's that?
Yeah, better.
Better? Okay. So we're going to camp out here for about 10 minutes, okay?
So how does this exactly help with the... So the I know the electric-magnetic stimulation is to promote the blood flow, correct?
Yes, that's part of it, yes.
And then
Fuck, I gotta clean that.
putting the needle through is to release the tension, or what else?
So with acupuncture, yes, there's the mechanical tension release of inserting the needle, right? And the needle itself also does bring targeted blood flow to the region too. So it kind of works in the same mechanism. But as far as for how acupuncture functions, it is based off of, what is this? Yeah, so there's two prevailing theories around this. Theory number one is this idea of something called pain gate theory. Okay, have you heard of this before?
No.
That's okay. So pain gate theory is the concept that our brain is actually only able to register one sensation at a time. And now what do I mean when I say that? Well, when you are stumbling around in a dark room and you're trying to find your way to the couch and you bang your toe on the coffee table, what's the first thing you do with your toe after you swear? You grab it, you squeeze it, you rub it, right? Yeah, okay. That's pain gate theory, okay? Because the idea is that in rubbing the toe, you are overriding the nociceptive, which is the fancy scientific word for pain, sensations, so that you don't experience as much pain, all right? It's a real thing, it's documentable. So that's number one with the tingling sensation brought on by electroacupuncture. It's the same concept with using a TENS unit. So theory number two is opioid-like theory, or opiate-like theory. Heard of this one?
Opioid-like theory, no.
Most people get scared when they hear the word opioid, and rightfully so, given the whole state of the opioid endemic. But opioids or opiate-like theory states that our body does secrete a natural degree of opioid-like compounds, okay? And the thing that secretes them the most, this is done primarily through exercise or muscle activation. That's why after you do have a good workout, your pain perception can be lesser and you feel good, right? Now, obviously, if you have a strained muscle or if there's some movement that's difficult for you, it can be difficult to go and do an exercise for it. But in providing an external source of muscle activation, in this case electrical current, we are able to replicate the effects of an exercise through that constant engage and relax, which stimulates the release of these opioid-like compounds to then provide pain relief. So those are kind of the two theories by which electroacupuncture functions. Does that answer your question? Mm-hmm. Good, there you go. Okay, time to take these guys out. Let's actually start by turning it off before I just go and grab the needle. All right. go. 3 clean removals.
Oh.
You are now needle free. You can slowly start to move around. How did you find all of that?
Honestly, I won't lie. Really, really weird. Because I have had this done to me before. But, like, the sensation was, like... Again, trying to relax the whole time was really, really hard.
Difficult
and I
time.
think just thinking about it was the hard part. But all in all, I know this stuff does make me... I know this stuff does make you feel better, so like the other part of me is like, hey, if you relax, you're just gonna be fine. So
it's much easier said than done, right?
Yeah,
it's like
easier said than done.
if somebody says, "Hey, don't think about your breathing," suddenly it's all
That's
you
the
can
first
think about
thing
is
about
like, "Oh, well, how am I breathing?"
Yeah.
Right? So
Yeah.
obviously, with acupuncture needles, they do come with a risk. If a patient is to tense up on insertion, there's a chance that they can break. There's a chance that they will come out bent, and you're essentially kind of ripping it out of the patient, which is not great for them or for yourself. So. The more relaxed you can be, the better. You actually did a pretty good job of that, all things considered. I've seen some patients who literally everything fires on. It's a nightmare taking them out.
Helps being a personal trainer understanding mind muscle connection.
Yeah,
It's
just
like
breathe.
breathe.
That was good. That was the first time you had it on your hamstring proper rather than solely the glutes.
Yeah,
right?
before it was like more towards my glutes. I think I've only had it on my hamstring. So the one thing you said was you put it in the semispinatus, and I think they just put it in one part of my hamstring, more one side, not so much, and a little bit more in my glute area as compared to. Sorry, I'm just trying to catch.
No,
up
this was a while ago, and you were kind of getting work on the table, so it's understandable.
Okay.
Yeah.
So yeah, but that's the one thing I liked a little bit more is that activation was there. And
Okay.
I kind of felt, again, like I said, when you first put the needle in for the first time, it was kind of like it closed and then it opened.
Everything
up,
just opened.
Yeah, everything opened. So I really enjoyed that too. So.
Now, what Amir's describing might sound a little bit strange if you've never had acupuncture before, but it really is a unique kind of feeling that words don't do a great job of explaining. If you've been dealing with wow, it's been a long morning, afternoon, evening, long day. If you've been dealing with a tendinopathy complaint and you haven't explored the concept of acupuncture, give it a try. It could very much help you, obviously under the guidance of a regulated health professional. Don't go stabbing yourself or your friends with needles, okay? Okay. Any other closing thoughts? Or
Closing thought was didn't really have to do a lot more with the alignment. It has a lot more to do with the muscle. That's one of my thinking behind it as well.
So, like I kind of explained beforehand, I do think that we might, like my leading hypothesis here, is that we're having a minor issue with the core bracing. If the core is not stabilized and braced and you go to do a heavy lift, the alignment actually will come into play, right? So you'll get a little bit of buckling of the lumbar, which then buckles the pelvis, and the ischial tuberosity is a part of that pelvis. If that moves in such a way as to put extra strain on the hamstring, it could be that is just the location, the start of the posterior chain, where you are getting that feeling of pinching, which could be a tendonitis complaint. So like my actual diagnosis for you would be a semimembranosus or a semitendinosus tendinopathy secondary to lack of core stability, underweight. Like diagnoses can be very long and obnoxious in name. It's a lot easier to just say hamstring strain, right? So
Fix your core.
it's a lot simpler.
Yeah.
So we'll follow up. All right, we'll see if that helps you or not. And I think we can get you back to squatting 3 plates. Cool. All right, so no problem there. But otherwise, thanks for coming in, Amir. It's been great talking to you. And you have yourself a great evening.
Don't forget to like, comment, and subscribe.
Thank you, Amir.